Hi everybody, this is Dr. Anugraha here. Today let's talk about anorexia. Now what is this anorexia? See, basically it is a eating disorder where the patient doesn't eat well, and in actual psychiatric terms he doesn't eat well because he thinks that he is gonna gain a lot of weight and he remains underweight. Okay, very malnourished. So in OPD practice, people come and tell you that they don't feel like eating. Okay, it may not be an eating disorder, it may not be because of fear of gaining weight, it's just that they don't feel like eating. Now in such a case, what all differential diagnosis should cross your mind? See, the first thing, the commonest diseases first. Okay, the first thing is stress. In today's life, everyone is stressed. Okay, be it exams, job, kuch bhi, they are stressed. So the first thing could be stress. So you can ask him to improve his lifestyle, go for some lifestyle modifications like yoga, meditation, do some sort of sports, brisk walking, and then you can check his HP. Even simple fever. Okay, fever can give anorexia. Okay, so it will come down once the fever goes. That could be another reason. Okay, or it could be jaundice. Okay, or liver conditions, and in chronic cases it could be malignancy. But that's that malignancy part should come to your mind only if an elderly patient with a chronic history of anorexia comes to you. Then the malignancy part should cross your mind. Otherwise, mostly it is the ones that I mentioned before: stress, or sometimes hepatitis, or sometimes even CKD. Okay, kidney problems can cause anorexia. So you can try giving a capsule Otrin for about at least 3 months. Okay, and then check if he still has anorexia. And also ask him to start eating a little bit of fresh fruits and vegetables. People who eat a lot of junk food, eventually what happens is their appetite eventually decreases. Okay, so ask him to switch to natural forms of food, fresh fruits, vegetables, right, because they are natural appetite stimulants. Fine. Also you can give them protein biscuits, that will work. And sometimes it could be parasitic infestations. Okay, so just go for a tab Zendel 400 mg, one stat you can try and give. And see, even if after all this, if he comes to you and says ki madam, मैंने सब कुछ किया पर yeah, still there is anorexia, still he doesn't feel like eating, then you have to actually work up the investigations. Okay, check for a CBC, HP levels. Okay, and bile salts in urine, go for a LFT. Okay, RFT, that is check urea creatinine. Now in India, okay, if he coughs, he tells you this, he has anorexia and he coughs a lot, you cannot not think about TB. So go for a chest x-ray also to rule out pulmonary TB. Okay, and pulmonary malignancies can also cause this anorexia. In an elderly patient, in such a case, elderly patient comes with chronic history of anorexia, then you should go for a USG abdomen gastroscopy to rule out basically stomach cancer. Okay, and also ask him if he is on any drugs like antihypertensives, metformin, then metronidazole, all of the digitalis, all of these can decrease their appetite. Okay, that could be another reason. Pregnancy, in females, think about pregnancy because some people have this aversion to food during pregnancy. In children, school going children, think about mostly it is stress. Okay, and and if the patient, another history I'll tell you, if the patient comes to you and tells you ki madam, the look of food, just when I look at food I feel like vomiting, I have this aversion to food, then in such a case you must think about infective hepatitis. All right, see, if it's a severe case, obviously you have to admit the patient. If it's very severe, admit the patient and start him on IV glucose. So yeah, that's it. And another important thing, okay, people who smoke a lot, who drink a lot, pan parak, all of these drugs, all of these can cause this eating disorder. Okay, eventually. So ask him to initially cut down alcohol, smoking, and if possible to stop them completely. Okay, so that's another important mode of treatment in people who are very addicted to smoking and alcohol. They can develop this anorexia and lose weight. Okay, so yeah, that's all about anorexia. Bye bye. God bless you all. Bye bye.